If you're a physical therapist or you're a patient dealing with a problematic anterior pelvic tilt, then this video is for you. What's up, guys? My name is Dr. Brian Larish, and I'm the owner of Performance Redefined, a cash-based physical therapy clinic, in addition to the creator of the PT Growth Academy. And the goal of the PT Growth Academy is all about raising the physical therapy standard. And in today's video, we're discussing anterior pelvic tilts, but specifically how to take this complex topic and hopefully put it in a really simplified approach. So that way, like I already mentioned, if you're a physical therapist or you're someone that is dealing with some sort of problem relating to an anterior pelvic tilt, then you can solve it. If that's something you're interested in learning, stick through the entire video, because at the end, we're going to go through specific exercises and more so the principles of the exercises. And that way you can try them out, but you can also make them specific to you. With that said, let's jump right in. The first thing we need to understand is visually, what is an anterior pelvic tilt? An anterior pelvic tilt is when the pelvis tips anteriorly. I know, groundbreaking, but we're going to have associated things with that. We're going to have a rib cage that flares, a spine that is going into extension, and a center of mass that is pushing forwards. This creates a lot of toe walking, a lot of tight chronic calves, and this is all because we're in a forward center of mass dealing with a ton of extension. So that probably wasn't anything too complex and ideas you're already familiar with, but now I want to talk about the biomechanics. This is where I think a lot of people overlook. Once you understand the biomechanics, meaning what is happening here as a result of an anterior pelvic tilt, then you'll know exactly what you need to do to fix it. So the easiest place to start is the anteriorly tipped pelvis, right? We already know this. But what's happening? The sacrum is moving into nutation. All these are exaggerated motions, so you can see for video demonstration purposes. Nutation, or forward of the sacrum, the innominate bones relative to that move into extension, internal rotation, and adduction. That's great. What I like to take from that is what's happening from a compression and expansion standpoint. If we turn the pelvis around, when we move into internal rotation, the posterior aspect is expanding, which means the anterior side is going to compress. What does that mean? That means that we usually don't have space in the anterior side, and we usually have space to move in the posterior side. That is really important to know, because knowing that, you now know what you need to do to fix an anterior pelvic tilt. Before we get into that fix, I just want to say that when you're in an anterior pelvic tilt and an internally rotated position, it lets you be really good at a couple of things. Number one, it helps you hinge. It helps you move in this horizontal trajectory, such as the requirement of a deadlift. Number two, it's going to help you generate massive power. Internal rotation is power. So if your day-to-day life or sport requires power, you definitely want an anterior pelvic tilt. Just know that with all good things, there may be a consequence, aka low back pain, upper thoracic pain. Why? Because the response of an anterior pelvic tilt is extension here, and those muscles start to turn on all day, and we just start to live, and it's this vicious cycle. Point being, an anterior pelvic tilt is not necessarily a bad thing. I want you to remember that as we talk about fixing an anterior pelvic tilt. It is 100% needed until it's not, until it overtakes your life in a way that you are living in this pattern and it's creating a vicious cycle of pain. So keep that in mind as we move forward. We need an anterior pelvic tilt through a lot of things that we do. We're just talking about fixing it if it's become a problem. Now let's jump back to that fix. To get someone out of an anterior pelvic tilt, we need to do just the opposite. We need to compress posteriorly, which automatically expands anteriorly. So this means when we think about exercise that we want to do, we want to choose exercises that compresses the posterior lower pelvis. And compress is just a fancy word for concentric or shorten. So essentially, we want to get the glutes, the external rotators, the hamstring in more of a shortened concentric position. That is going to compress here. That is going to posteriorly orient the pelvis. That is going to increase the space anteriorly. That is going to change this person's pattern. To get long-term results, we need to disrupt a pattern. We can't keep them in this forward position and just try to work the legs. It doesn't do anything long-term. So when it comes to our rehab plan, our rehab goal, first things first, we need to get in a good position where the rib cage is stacked over the pelvis. Then we need to learn how to breathe, and then we need to create compression in the right places and expansion in the right places. So with that frame of mind, let's go over a couple exercises, but you now know the principles. Do what you want when it comes to the exercises, just follow the principles and make it specific to your patient and or yourself if you are looking to fix it on your own body. So with that in mind, let's jump into some of the exercises that I like to do to fix an anterior pelvic tilt. The first place I like to start is breathing in a hook lying position. When you go in a hook lying position, you're automatically coming out of that extension pattern just by throwing the legs up. From here, what we're going to do is make sure that our patient understands how to move the pelvis posteriorly. If they don't, we can cue them to arch their back and then move in the opposite way. We can cue them to tilt their belt buckle towards their chin. What we don't want is them just forcing their back and spine to the ground. The spine will move as a result of moving the pelvis. We don't want the spine moving without the pelvis. So keep that in mind because a posterior pelvic tilt is tricky to coach. Once they feel confident with that, we're going to find that kind of neutral position. They don't need to be in this crazy rounded position. And then we're just going to go one hand on the chest, one hand on the belly, and we want to start to get them to exhale where their ribs can come down. And then they need to hold those ribs down and inhale and start to get expansion at the chest. When we're in this extended pattern and we have that mid-thoracic pain, low back pain, our breathing tends to be only belly breathing. So we're doing so many things here that is different from their norm. Positionally, we're putting them in there more of a posterior center of mass. Breathing, we're starting to expand areas that are super compressed. When we can start doing this, we're starting to unlock different areas, aka the mid-thoracic area, that is usually super compressed on these individuals. And so this is why any sort of breathing in a hook lying, a side lying position is a great starting point to start to change an anterior pelvic tilt. So a nice follow-up to the hook lying is putting them in a position that really starts to challenge that extension pattern they want to find. So in all fours, breathing exercise is my next go-to. What's nice about this is it's still focused on breathing, but they need to really maintain their good rib cage position, their pelvis position, and be able to breathe. So it's just one more layer of complexity. How you want to cue it is as follows. Head down, chest up. Chest up doesn't need to be 100%, doesn't need to be 0, about 60%. Belly button up, tuck the tailbone. Now from here, they should already start to feel some abs and they can just work on their good breathing here. Then we can start to lift. But when we lift, we cue it as follows. Belly button lifts until the hips come off the ground. When you cue it like this, it shifts the focus to the abs. And that way the abs can start to lift the body, really start to be engaged compared to just popping up and using the hips and the arms as a stability point. So a great way, and if it's done right, it's a very challenging exercise. So we've talked about positioning, breathing, and abs. Now we want to talk about strengthening. The goal here is we want to start to change the position that our body's in and then start to strengthen certain muscles to hold it there. And that's what an isometric foam roller hamstring curl is. We're going to go down and throw your heels on the foam roller, specifically the heels, because we want to be at the midfoot when we're done. So heels are on top. We go into a slight posterior pelvic tilt. We continue to maintain that as we go up. This is where a lot of people lose it, and people tend to go too high. We don't need to be super high for this. Actually, if you do this right, the second you come up, you should start to feel hamstrings. Why? Because we are in a posterior pelvic tilt, and the hamstrings need to be engaged to actually achieve that. Next, we're just gonna pull the foam roller back and we really get these hamstrings engaged. I'm checking this, I can be a little bit more in the posterior direction. And then we're just gonna work on breathing. You can throw the arms up, but the goal here is start to strengthen this position for the end goal of the body learning how to maintain this position. And the way that we maintain it is by having muscles that are strong enough and have the awareness to do so.